Caulfield.
Thank you, Mr. Speaker. It's a pleasure to follow the Honourable Member for Lewisham East, and she won't be surprised to know that while I agree with some of the points she made, I don't agree with all of them. And in the time that I have, I do want to just cover a few points. I don't want to repeat much of the excellent statements that many members have made across this House. But the time I do have, I want to go over just a few issues, because while I do welcome the government's extra funding and the £6 billion this year in particular, with the changes in national insurance contributions, pension contributions, the costs of running the NHS are going up all the time. That extra money is being swallowed up without it necessarily going to frontline staff. And I do particularly agree with the Honourable Member for Newton Abbott when she said that in an estimates debate we shouldn't be just talking about the money that we need to spend, but we also need to be looking at the demand and the type of services that we need to fund, because there's no doubt that demand for the NHS services and social care is increasing. So even by providing extra funding, we're just really standing still in terms of the services that we're providing. We know there's an increase in numbers across the country. We know, as has been said by others, that there's new treatments that need providing, and we know that patients are changing. They've often got multiple comorbidities. So in years gone past, they would have been admitted with one illness, treated and gone home. Now when they're admitted, they've got many illnesses that are not so easy to treat, and that's often why discharges are delayed. But if you just look at the NHS England's data that it provides itself, we know there's around a 7% increase in terms of demand for services across the board. There's a 7% increase in the number of ambulance calls made. There's a 3% increase in the number of A&E visits. And we know that the Tuesday after Christmas was the busiest day in the history of the NHS ever. And that takes extra money to be able to deliver that. We know for diagnostic tests there's a 6% increase, and we also know that consultant-led treatments are up by 6% as well. So demand is rising. So the extra money is welcome, there's no doubt about that, but it's not actually dealing with the level of service that is required. But one point I would like to make, and this is just a plea as someone who still works in the health service and still sees and works with colleagues across the NHS on a regular basis. While there is a lot of pressure that the services are under, and there's a lot that we can be concerned about, there is some amazing work that's going on in our NHS. And I welcome the NHS England's announcement only last week that it's going to start to fund again second stem cell transplants, because we have had debates in this place about how important that is to those patients whose first transplant actually fails. We know there's going to be new drug treatments for kidney disease, and we know new treatments for pulmonary hypertension. All are really welcomed announcements, and we must recognise that there's some great work that's happening there on the front line. I'm particularly pleased that the government once again, Department of Health gave £1 million, I'd love £1 billion, £1 million to the British Heart Foundation to provide defibrillators up and down the country. That will make a tremendous difference when we know that 12 young people a week die in this country from cardiac arrest. There's innovative work, groundbreaking work happening in the field of cancer care. In my old hospital, the Royal Marsden in London, we're making strides in cancer research that are not just innovative in Europe, but are making worldwide breakthroughs. And we should never forget that we are often leading the field in research on a global level, and it's something we should be extremely proud of. Now, in response to the Health Select Committee's report, the government made a number of recommendations in how to tackle some of the problems facing the NHS and facing social care. And I just want to touch on two of them. The first was to try and arrive at a type of financial discipline in the health service, because for years now there have been problems in terms of financial mismanagement. And I know, as someone who's worked in the health service, how heartbreaking it is to see money being squandered. You know, we've talked about the PFI deals here, which have touched many parts of the country, but there was also the IT system that was cost billions of pounds that never saw the light of day, which was supposed to move us away from paperless records or paper records to a paperless system. And today the NHS is spending huge money still on paper notes and storage, off-site storage facilities that hospitals are having to pay for just to keep patients' records. We know the whole Agenda for Change system that was introduced many years ago now was supposed to reconfigure this pay structure for staff and improve patient productivity. It never really did, and it just rearranged the deck chairs on the ship, and actually that was a huge wasted opportunity and cost the NHS millions of pounds, when instead staff could have been given a well-deserved pay rise and seen the same result. So financial discipline is important, because if you look in the two big district general hospitals near my constituency, who have the same financial settlement and a similar group of patients to look after, one hospital is in special measures and is struggling to cope with its discharges. Another, less than 5 miles down the coast, is rated as outstanding and is able to provide excellent care. So there has to be something, not just about the money that's given out, but what is actually done with that money that we need to be looking at and sharing best practice, because it cannot be right that one hospital is able to manage its budget and another one isn't. And so my experience over 20 years of working in the NHS is there are lots of opportunities, and financial discipline shouldn't be about top slicing, it should be about using your money as wisely as possible. And Mr. Speaker, I would recommend, if ministers wanted some suggestions about how to make financial savings, that actually speak to the healthcare professionals, because very often they have the answers, and if they were only asked on a more regular basis, would be able to provide some fantastic solutions. The other recommendation that the government wanted to take forward was about reducing demand, and I think that's easier said than done. I started by saying that demand is on the increase by about 6% a year. But it is, I think for too long now, we've been so focused on hospitals, and with no disrespect, and I see my colleague, the Honourable Member for Totnes sitting beside me, no disrespect to doctors, but we've been very medical focused in the way we manage our NHS, and we've missed an opportunity with looking at what other healthcare professionals can offer. Pharmacists, for example, are highly educated, highly experienced, highly qualified individuals, and there's some groundbreaking work happening out there in community pharmacies. And simple things, as they do in Scotland, for example, about having a register, so patients have to register with a pharmacist as well as a GP, would make a tremendous difference to patients' lives. Why are pharmacists not contacted on discharge like we contact GPs? I was talking to pharmacists recently who said that around 30% of readmissions are caused by patients not taking their medicine properly on discharge. If a pharmacist was contacted, if they had a list of chronically ill patients and they were in charge of managing their medicine, so many readmissions could be easily avoided. Nurse practitioners, we heard from my honourable friend who talked about the role of nurse practitioners who are doing blood tests to predict bacterial infections and who needs an antibiotic and who doesn't. But we need to be upskilling those healthcare professionals so that they can take on more roles. And I just really want to finish really. We've got other excellent examples of paramedics who are in the community, who are going to people's homes instead of them going to A&E. And I just really want to finish by saying this is an estimates debate about how we use the money, but we need to properly forecast demand, we need to use existing resources better, and we need to look at best practice to share the good work that is happening in our NHS.
Order.